Chris Udovich, Chief Medical Officer for Silver Cross Hospital. Today I'm here with my esteemed colleague, Dr. Atul Gupta, the Medical Director of Infection Prevention at Silver Cross Hospital. Today we're going to talk a little bit about COVID, the COVID status in the state of Illinois at Silver Cross, and a little bit about monkeypox.
The dominant strain of COVID right now is called BA.5, and it has been circulating in the Illinois and in the U.S. for the last couple of months. It has now become the dominant strain, and the main difference between BA.5 and previous strains is that it's more contagious. It's not more severe, which is fortunate. We're not seeing more severe disease from it, but it is easier to spread, and I think that's pretty apparent in the community with higher cases. So the good news, even though we are seeing this new variant that is more contagious, the vaccines are still very effective at preventing severe disease, hospitalization, and death. A lot of the vaccines we give, actually, the main point of them is not to prevent infection in the first place, but is to prevent those serious complications and death from infection. The flu vaccine, the pneumonia vaccine, those are just two examples. We do have more recent data now, even with this new variant, that the vaccines that we had, if given with a booster, really do still work very well for that. And we're seeing that in the hospital. Almost exclusively the patients we're seeing in the hospital with COVID who are very sick are either unvaccinated or they got the initial vaccine series and no boosters. A booster is very important. The most recent data definitely shows that the booster does prevent severe illness, and so anyone who hasn't gotten their first booster should definitely do so. And people above the age of 50 or anybody with a underlying condition that puts them at high risk for bad outcomes from COVID should get that second booster as well.
Yeah, so if your at-home test is positive, my first suggestion is 1, isolate, okay? 2, you really should talk to your clinician, okay? Go over your signs and symptoms of what you have, what's happening, okay? You want to notice if you're having trouble breathing, are you short of breath, are you having high temperatures, are you having uncontrolled cough? Because that's important to go over with your physician so they can help guide you properly as to what you should or shouldn't be doing, let alone try to understand how long you should isolate for, okay, and then wear a mask. Now, routinely, most people will isolate for 5 days after the start of symptoms and have to mask for another 5, but there might be variations on that depending on your symptoms, how well you return, and what your underlying medical conditions are.
The school environment is unfortunately a high-risk environment for transmission. Of course, lots of people packed in tightly and a lot of potential for transmission in the school setting. The great news is that vaccines are now approved for anyone over the age of 6 months. We've given millions and millions of doses of vaccines to school-age children in this country, and there haven't been any serious adverse events reported. And so for parents who have children going back to school, number one recommendation is to get your kids vaccinated. Vaccines are readily available. Again, safe and effective for the school-age child. Really your best chance of preventing that child from bringing COVID home to the family. There's a lot of talk out there about kids don't get very sick from COVID. That is generally true, actually, but we are learning more and more about the long-term effects of COVID, especially in the pediatric population, and there are very real concerns about that. So even if we're not overly concerned about the short-term complications of COVID in the pediatric population, the long-term effects are still being studied, and there is definitely concern. Monkeypox is a pox virus, not surprisingly, similar to chickenpox and smallpox. It has been mostly found in Africa until now, but recently there have been cases spreading across Europe and the United States. It's not a new virus, but this widespread finding of monkeypox is definitely new. Really, it had been confined to certain parts of the world, and we didn't see it in the places we're seeing it now. The good news, if there is any, about monkeypox is that it is not that easy to spread. The main mode of transmission of monkeypox is actually very close, prolonged contact with someone who's actively infected with their skin. If they have active monkeypox lesions, especially those lesions you can catch it from. But it's difficult to catch in a casual encounter with someone with monkeypox. The other main modes of transmission are kissing, actually contact with clothes, linens, and towels that a monkeypox patient has used, and then prolonged face-to-face contact, having a very close conversation with someone with monkeypox. The vast majority of cases in Illinois are in the Chicago metro area, and almost all of them, although not all of them, are in a population of patients that are men who have sex with other men. That community right now is unfortunately being very hard hit with monkeypox, and they're at the highest risk right now. But unlike COVID, we don't expect people to be getting it at the grocery store or on public transportation. So it is easier to avoid getting monkeypox.
I want to thank Dr. Gupta for joining us. Thank you for listening to our program, and have a great day.